Welcome to this video about communication and behaviour. All children sometimes have behaviour which challenges us, but we know that this happens a lot more for children who find communication difficult. In the video, we'll look at why that is. Then we'll go through some advice about what to do when the behaviour happens and how to help it happen less in future. There are no quick fixes, but we'll talk about tried and tested approaches that have been helpful for other people whose children had trouble with behaviour. To work out why behaviours happen, we sometimes think of an iceberg. The only part you can see is the small part sticking out of the water at the top, but it's the much bigger part underneath that does all the damage. With children, what we see is the behaviour on top, whether that's biting, screaming, hiding, hitting, covering their ears, running away, throwing things, banging their heads, lying on the floor, kicking, spitting, or whatever else. With any behaviour, there's always a reason underneath it. Sometimes that reason could be quite obvious, but sometimes it really seems like the child is doing the behaviour totally randomly. But once you manage to work it out, every single behaviour is telling you something. There are all sorts of reasons for challenging behaviours. It could be the way your child feels inside, something in the environment, or an event that's happened. It will get easier to deal with the behaviours as you work out what they're telling you. And we'll look at how to do this detective work later in the video. But also, I would really encourage you to use your instinct as the person who knows your child best. Remember that there definitely is a reason, and take your best guess. If it turns out not to be right, you can always keep guessing until you do work it out. We're going to talk about what to do in the moment when the behaviour happens. It's called the calm palm because you can use the letters PALM, P-A-L-M, to remember it. So the P is for pause. You need to contain your own feelings and keep them quiet inside you while you're helping your child. Otherwise, they'll pick up on your feelings too and the situation could escalate. So give yourself a bit of time for this because it's not easy, but you can do it. And it actually doesn't take as long as it feels like it's taking at the time. The best thing for your child is to be, at least outwardly, calm. A is for attune. Think about how your child is feeling. You don't have to accept the behaviour, but try to listen to and accept the communication underneath it. There's no way that you can reason with your child until they're calm enough, and depending on your child, maybe not at any time. So it's more important to focus on how they're feeling and how to help them feel better. L is for label. In time, we want your child to learn how to manage their own emotions. And to do that, they need to learn to recognise what the emotion is. Some children learn the emotions by understanding how people are feeling around them or in stories. But for children with communication difficulties, that can be really difficult, so it's important to give them a label they can match to their own experience. That can be a word, sign, picture, symbol, or gesture. And M is for model. Show your child what they can do instead of this behaviour. Next time they feel this way, what would you like them to do about it? Show your child so they can physically see what you want them to do. Avoid talking too much at this point, as trying to understand you could be really difficult and stress your child out, which is the last thing we want when they're already upset. Just quietly show them and help them to learn a new, better way of responding. So I've got an example of this. Imagine a child who is hitting her head on the wall when visitors come to the house. So firstly, get your hand, your body, or a pillow in between the child and the wall. That way you know they're safe and it's okay to take a few seconds to prepare yourself. So just personally, I like to feel the connection of my feet on the floor and I take a few deep breaths. And even though sometimes I might feel I don't have time to do that, actually it takes less than 5 seconds and I know it helps me put a pause on my own feeling of anxiety. That time also gives you a chance to work out what the child is feeling so you can name it for them. Again, keep your talking minimal, but do provide a label. And then you know better than anybody else what would help your child when they feel that way and what you can model for them. So if it's visitors, maybe you could help them move to a quiet corner and just watch for a bit. Maybe there's a certain toy that helps your child calm down and you can fetch it together. You can model taking some more deep breaths, blowing bubbles, sipping water, squeezing your hands. And remember, it's fine to experiment for as long as it takes to find something that works for your child. If it's really hard to work out why someone is doing a certain behaviour, you might need to do some detective work and gather information. You'll then be able to look for patterns. So just record what happens with one behaviour at a time so the patterns don't get muddled. So keep a note of what happens before, during and after the behaviour occurs every time. You can draw it out in a chart like this, or just keep it as a note in your phone, whatever's easy for you. But do try to fill it in as soon as possible after the behaviour while your memory is fresh. So this example is for biting. So you would just fill it in every time what was happening at the time the biting happened, the details of the event, and then any consequences, whatever happened after the biting. And then maybe there's some throwing or some head banging, but that doesn't go on here. This chat is for biting. But then next time there's biting again, you would just record the time, the circumstance, the event, and the consequence. And you keep doing that every time, and hopefully you would see a pattern that would help you work out why the behaviour is happening. If you don't see the pattern yourself, you could bring this chart to a therapy appointment and discuss it together with a speech and language therapist or an occupational therapist. Lastly, we've talked about how all behaviour is communication, and as your child develops more positive ways to communicate, they'll feel less and less need to use the behaviours. If you've already seen a speech and language therapist, then focus on the advice they gave you. But something that's good for all children is child-led play. So watch what your child's interested in, wait for them to initiate and lead you, listen to anything they're saying or trying to say or communicating, and respond, and make that cycle of letting them lead and then responding, which is really important for building communication skills. You can watch our video about understanding communication for more advice about developing positive ways to communicate. Remember that reducing challenging behaviours is tricky and it can take time, but you can do it. Look out for every small step of progress and celebrate along the way.